Welcome to Brief Encounters, the DC Bar Community's podcast channel. My name is Tom Kane. I am a member of the DC Bar's Wellbeing Community. Today's episode is part of our Wellbeing Community series, The 6 Pillars of Wellbeing, which focuses on helping attorneys thrive both professionally and personally. The 6 pillars are derived from a report that was produced by the National Task Force on Lawyer Wellbeing in 2017, entitled The Path to Lawyer Wellbeing: Practical Recommendations for Positive Change. The report made recommendations for a number of stakeholders in the legal community, including judges, regulators, legal employers such as law firms, law schools, bar associations, professional liability carriers who deal with the legal community, and lawyers' assistance programs. Well-being, according to the report, is based upon 6 pillars or dimensions. They are occupational, emotional, social, intellectual, spiritual, and physical. The legal profession is demanding by nature, but your well-being doesn't have to be at the price of your career. This series explores the 6 pillars of well-being and their impact on attorneys, sharing perspectives, tools, and conversations that support a healthier, more sustainable legal profession. Because when you care for yourself, you'll be better able to care for your clients and your work in an ethical, diligent, and competent manner. Today's pillar is the physical pillar, which, according to the report, has several different elements. One is physical activity, one is nutrition and diet, and one is sleep. But for today's podcast, we will focus on the physical activity element. And I'm very pleased to welcome our guest speaker for this session. Dr. Stella Volpe is currently the department head and professor of the Department of Human Nutrition, Foods, and Exercise at Virginia Tech in Blacksburg, Virginia. She has a PhD in Human Nutrition and Foods from Virginia Polytechnic Institute and State University, and her research focuses on obesity and diabetes prevention using nutrition and exercise interventions, mineral supplementation, and altering the environment to result in greater physical activity and healthy eating. She conducts research on athletes of all levels, from recreational to professional. And obviously, many of the people listening to this broadcast will fall into the recreational category. Importantly, Dr. Volpe is also a past president of the American College of Sports Medicine. And today we're going to talk about 2 items that the American College of Sports Medicine addresses that relates to physical activity and the environment in which physical activity is conducted. So, Dr. Volpe, thank you very much for joining us.
Thanks for having me, Tom. It's really a pleasure.
Well, the pleasure is all ours, believe me. And I'm excited that you can share with us some of your background and experience, and specifically the 2 things that we're going to talk about today, and that is the physical activity guidelines that are put out by the college and the fitness index, which, as we will discuss, is important in terms of the environment that we find ourselves here in the DMV. And if people aren't familiar with that acronym, it's the District of Columbia, Maryland, and Virginia. And so with that, why don't we just dive into the subject matter and see where this takes us? To kick it off, because I mentioned it, what is the American College of Sports Medicine? What does it do? Who are the members, and why is it important in terms of the physical activity community?
Sure. So the American College of Sports Medicine, or ACSM, is the largest sports medicine organization in the world. We have over 50,000 members to our organization, ranging from PhDs like myself. I have background in both nutrition and exercise physiology, MDs, physical therapists, athletic trainers, nutritionists, the gamut of those who are clinicians and all the way to researchers, and then from very basic researchers all the way to the community type of research and anything in between. And why we are so important is because we lay the foundation of sports medicine in the very broadest sense, right? Because you can hear just from my description the breadth of folks who are in our organization. And we provide these foundations and guidelines for exercise testing and prescription, for example, sports medicine, clinical backgrounds. And then we also have 6 journals that come out of the American College of Sports Medicine that, again, provide the gamut of research across all those areas.
If I were to walk into one of the many fitness facilities here in the District of Columbia or the surrounding area, it is likely I will encounter someone working at that facility with some sort of accreditation from the college.
I hope you do. I'm American College of Sports Medicine Clinical Certified Exercise Physiologist, or ACSM CEP. There are a gamut, again, of levels of certification that we provide that are based on sound science. And so I do appreciate that. We have health and fitness instructors, we have personal trainers, we have, someone like me, we have those who are, have a higher level of certification. And I will tell you that these are very rigorous and science-based certifications. So if you see someone have one of our certifications, that's a really good thing.
Well,
I'm a little biased, but it's a really good thing.
I'm a little biased too, so I fully agree
Thanks,
with
Tom.
your assessment. The college puts out physical activity guidelines. In the broadest sense, and maybe we can narrow some of these issues down, what are the physical activity guidelines promulgated by the college, and why are they important to people who are or should be regularly engaged in physical activity?
Absolutely. I want to just state that included in those physical activity guidelines, they are led by the US Public Health Service, right? So we're part of those guidelines as well. In the past, the American Heart Association as well. I want to just make sure I give credit where it's due. But as well as those physical activity guidelines that are US nationally based, we also, as the American College of Sports Medicine, have our own guidelines for exercise testing and prescription to ensure that people of all ages and with any type of condition, that we're making sure that we're having safe protocols for them. But getting back to your question, and that is these physical activity guidelines are established for the general US population, again, but all ages, and trying to make sure that they're safe for individuals to, number one, get active, but number two, be safe in that activity, but also combining the type of intensity of exercise as well as including resistance training. So these guidelines are meant to help people, just like other guidelines, are meant to help people get moving, but also doing so safely and doing so under a very good science-based background of, yes, these are the types of exercises, whether it be walking or cycling or swimming. And if you're going to do a higher intensity, you don't necessarily need to go as long. And if you're going to do a lower intensity, you probably need to go longer, and then incorporating resistance training in that.
So if I'm a young associate at a law firm or a senior partner or a member of their professional or administrative staff, the guidelines would apply equally as a general matter to people in each of those categories.
Absolutely. There are some guidelines, mind you, if you're below a certain age, above a certain age, if you have a condition like a heart condition, there's definitely stipulations in there. But yes, they would apply equally because you could find where you fit within those guidelines. And because they're general, mind you, there are certain populations who they might need to adjust them a bit, I guess is what I would say.
And I want to get specific on the general guidelines here in a second, but if I'm a member of the general public, not a member of the ACSM, can I find those guidelines on the ACSM's website?
Actually, you can find them on the United States Public Health Service website. People can literally Google the guidelines and they can find them. They are publicly available.
Not a secret.
Not a secret, as they shouldn't be, because we want people to see them.
So what are the general guidelines that apply to people on a regular basis?
On a regular basis, and I want to make sure these are my words, not directly from the guidelines, because these are things that I profess to people and have been for a very long time. First and foremost is to try to get moving every day. We all should try to move every day in whatever capacity we're able, because our bodies are definitely meant to move. I will use a trademark from the American College of Sports Medicine to state that exercise is medicine, and that we know that exercise can help to stave off disease, can help prevent disease, in particular chronic disease. It doesn't mean it's a pure cure. We know that, right? But that exercise is definitely the best medicine to help us to prevent chronic disease. Not only getting moving every day, but try to vary that movement if at all possible. and include some type of resistance training. And I say resistance training, Tom, because I don't want people to think that they need to go to a gym and lift heavy weights a couple times a week. They can use their own body as the weight. They can use soup cans in an old bag at home, right? An old like purse or bag that they might have that's from a conference, for example. We get so many of those bags at conferences, but using something and putting some weights or soup cans in there. Resistance means that we're getting some mechanical loading on our body to help maintain muscle mass and bone mass, especially important, more important as we age. So moving every day, trying to mix things up, trying to add some resistance training, and also to have fun, because it's really, really important that we enjoy the activity we do. Those are my 4 little quick pillars, if I may use that term, to weave that in to state that some movement is better than nothing, and that it doesn't have to be, I have to run or I have to do 5 miles every day. Because the message I hope I can get across to your audience today is some movement is better than nothing, and to not beat themselves up if, for example, they plan to do longer one day, but then work got in the way. But if they got something in, that's still healthier than sitting all day and working at their desk for hours upon hours because they have a big case, for example, that they're working on.
I find it interesting when people ask me the question, I would say, just go to your pantry or go to your kitchen cabinet and see if you have a couple of 1-pound cans of baked beans. And you can do simple arm curls and presses with that. And for most people, you have to do some repetitions, but that clearly is enough to put the right amount of stress on your body to get the benefits of resistance or strength training. And it's that simple for most people.
It really is. And mind you, for some people that could be too light over time. That's actually fine. That shows that they're gaining something, right? But also even things like push-ups. And people will say, well, Stella, I can't do the regular push-up. Then I'll say, all right, then use your knees or go against, for example, a table. I know you can't see me, but something a little lower that provides you a little bit of elevation, but you're still getting that resistance. There's so many little things people can do that they can build up to as well. But I'm so happy you use the soup can thing. I've been using that for years, especially if, again, people don't have time. And maybe, just maybe, if they're exhausted and they want to watch a little television after work, that they could do this in front of the television at home.
The other thing I say to drive that point home is that if I went out and bought one of the newest and most expensive exercise bikes on the market, most of them these days come with a pair of 1 or 2 pound weights hanging from the back of the seat that you can use while you're riding your bike. Well, there's no difference between a 1 or 2 pound weight and grabbing those cans out of the kitchen cabinet. They may look prettier, but functionally, you're going to get the same result, and you don't have to worry about whether or not you've got the right equipment in order to meet your minimum physical activity requirements, whatever they are.
Absolutely. And even if you think about it, if people work in their yards, for example, I'll take us to a slightly different direction. If they're doing yard work and they're moving some rocks around, little things like that, I want people to really, again, get the message that those movements, quote unquote, count. Parking farther away when you go to the store counts because now you're getting more steps in and you're not even realizing it. I know that some people listening to this might already have a high level of physical activity, but if we're trying to get people to stay healthy and make sure they're incorporating something in every day, if they get so busy, these little things do count toward their physical activity goals.
So 2 follow-up points. One, under the guidelines, are there minimum time, minimum repetition requirements that are suggested under the guidelines?
Are you talking about resistance training, Tom, specifically, or are you talking about minutes?
Both.
Okay. I'll talk to you about that for sure. So for resistance training, if we were going to do, and there's new American College of Sports Medicine guidelines specifically with resistance training, which people should be able to see because they're published in one of our journals. But basically, when you look at the guidelines, it's about 10 to 12 repetitions of using, a medium weight that someone can do 10 to 12 times. And then if they achieve that and do that easily, say for a few weeks, they would up that for a little bit. and maybe add maybe a little bit more weight. So for weight training, minimally twice a week if you can, about 10 to 12 repetitions per body part area, if that's possible. And then for aerobic exercise, generally we say about 150 minutes per week if people can accumulate that. So we're talking that's 30 minutes 5 times a week, or a little bit less if you go 7. But again, I want people to understand, to think about the things they do during the day. Should that 30-minute time at one time point not be feasible for their schedules? People may not realize this, but accumulating physical activity throughout the day can be equally as beneficial for our aerobic capacity and cardiovascular fitness as does exercising in one bulk part of the day.
I've heard the term used called exercise snacks.
Love that term.
And that's what you've just referred to. Is that correct?
Exactly. I truly think that term is so fun. I've heard it more than once, and some of my colleagues use it, and it makes me smile every time. And I'm glad you brought it up because it really is a great little term for people to think about.
And so when I look at the guidelines again, and you mentioned 150 minutes, 30 minutes a day, give or take, do what you can. And the guidelines talk in terms of moderate to vigorous physical activity. Now, almost nobody on listening to this podcast will be health and fitness professionals or exercise scientists. Is there a way for a regular person to measure in a general way how intensive their physical activity is?
Yes. One easy way that many people have are their watches or their smartphones, right? And I'm not going to assume that everybody has them. Ironically, I don't use any of them just because for years I just kind of know, right, where I am. But what they can do is take a look at their watches, for example. So if, say, someone has any of those abilities to measure their heart rate, and I do not want to get too mathematical here, even though I know all you attorneys are so bright, but I'm just going to quickly say this because we have changed this a bit. So I don't want people also to write this down saying this has to be exact. But in the past, we've used something called the Carvonen method that I think you probably know, Tom, and that is 220 minus your age. But we've actually adjusted it a bit. But to be simple, let's just say 220 minus age. And since both you and I are only 20 years old, if we were 20, this is just to make the math fast. If we were 20, we would take 220 minus 20. And we could multiply that by whatever percentage we wanted to work in, say the 70% range, right? So our heart rate might be about 140 at a 70% range. You're talking 70% is about moderate. Above like 80, 85% is very vigorous, and you'd be above that. Your heart rate would be higher. But let's put all these technologies and mathematical equations aside. And let's say, okay, if I'm just running with a friend or walking with a friend, how do I know if I'm moderate or vigorous? I would tell someone, if you are moderate, likely you'll be able to keep a slight conversation with your friend if you're walking at a moderate rate or if you're running at moderate pace. If you're vigorous, the likelihood of you keeping a conversation would be much lower. And so for me, that's always been a little measure for me to tell anybody, because even if they have something that's measuring their heart rate, they still might want to know. And so just to be aware of that, I think that's a really, really easy way to know, okay, moderately I'm walking or jogging or running with my friend and I can keep a conversation, not every second of the time. But then if I'm going at a higher intensity, I'm probably gasping or breathing very heavily that I can't talk.
So that's a great way for anybody really to give a check for themselves in terms of what they're doing and how much work they're really performing.
I agree. And I also would like to throw this out here is, most of us know our bodies well. So pay attention to that. Pay attention to your body and how you're feeling, especially if you are just starting. And certainly in warmer weather, I would never recommend someone to start exercise the middle of a day in the summer, right? Earlier morning or evening are better. Listen to your body, but those little things about whether you can speak or not, I think can be very helpful for people.
Okay, that's great. Anything you want to add before we move on to the fitness index?
The only thing I would just say is try to get moving if you're not. And also, if you feel uncomfortable starting, get a good check from your physician to ensure that, all will be okay. But I guarantee people that if they're not exercising, if they get some movement every day, they will feel better, be more productive at work. And I know that your jobs are really intense. And honestly, that if sometimes in the middle of the day, you're in the middle of something that you just need a break from, taking a quick walk can really help you be more productive. You might think you're wasting time, but honestly, I'll do the same thing. I'm like, okay, I got to get away from this for a little bit. And I come back and I can think better.
That's actually a great segue because the way you've just described that, you're in a sense, you're talking about the environment, take a walk. The overall environment where you live or work is important in terms of whether or to what extent you want to be physically active. And that's something that the fitness index actually addresses. So, what is the fitness index? Why is it important? And what are the components generally that go into the measures that the fitness index uses?
So the ACSM American Fitness Index was something that we as the ACSM developed. I've been on it since its inception almost 18 years ago. And we wanted to do this because we wanted to assess different cities across the United States on different variables, both personal level as well as environmental levels, where we evaluated publicly available data from, say, for example, the Centers for Disease Control and Prevention, the CDC, and any city level data that we have. And I will make sure I tell you that we have wonderful statisticians who help us do this. I can look at the outcomes, but they're the ones who do all the hard work. And what we've done, Tom, and what we continue to do is we will choose the top 100 cities across the United States as far as census is concerned. So we only have funding to do a certain amount of cities. We wish we could do every single city and smaller town, but we have funding to evaluate the largest 100 cities. So sometimes cities will go off and on this, our fitness index, because their census will have dropped. The number of people in their cities have dropped. And we evaluate things like parks that are nearby, available swimming pools. We actually added splash pads this year. Walkability of a city. Do they have trails? Bike trails, walking trails, tennis courts. Now we added pickleball courts to our assessment. And then we sort of look at that against the healthiness of the population. How many of them smoke? How many of them have diabetes mellitus? How many have cardiovascular disease? And we rank them based on weighted measures. And then that's how we have our ranking of the cities based on our American Fitness Index.
So the fitness index comes out every year, and I think it comes out in July. So we
Yes.
will have a new one coming out shortly. But the fitness index that came out last year, the 2025 fitness index, and this is important for the people that live in this area, had some very high rankings for a couple of our geographic areas.
Indeed. Arlington, number one again for the 8th year in a row.
And where did DC rank?
I think DC was third, weren't they, Tom? I believe.
I think they
I'm
were second.
embarrassed.
I think
Okay,
they were
they're second. Forgive me for that.
That's
I should
okay.
have.
And I think that's important because as we live and work here, and we have a fairly extensive legal practice and presence in the area, whether it's law firms, law schools, courts, and we want to get people physically active, we live in an area that is, quite frankly, the best in the country for terms of the physical environment that we can use to be active in, if that makes any sense.
It does. And frankly, what I tell people when I get interviewed about this every July, right, after the new rankings come out, because the big question is, for example, in this regard, why is Arlington always number one, or at least for the last 8 years? Well, they have a really great built environment, which you alluded to, right? The accessibility to parks, the accessibility to trails, even the accessibility of those living in the Arlington area to walk to coffee shops or walk to lunch during, say, the workday is really great. What I mean by that is even, like they're going to eat, but yet they can walk there. Your public transportation systems in that area are excellent. But the caveat of that too is the resources are there. And so we do the American Fitness Index. We've done the Fitness Index for years. It is not to chastise or put down those cities that are toward the bottom. It's to make sure that we can try to, hopefully, those cities can maybe put some funds toward helping those cities to have more accessibility for all of the people in those cities.
Yeah, we here in DC are lucky that we have a lot of federal parkland.
You do. And I should have said that. DC and Arlington, really, honestly, both of those areas, excellent resources there.
It brings home a point that you alluded to earlier in that you want to take a break. You're sitting at your desk, want to take a break, you want to go and take a walk. How cool is it to go out and take a walk on the National Mall?
I was thinking that.
How cool is it to take a walk across the Memorial Bridge over to Arlington Cemetery or run over there at noon like a lot of people do a 3 or 4 mile route around the mall and over the bridge and back? It's amazing how we here in the DMV can literally walk out our doors and into such a plethora of exercise opportunities that many people may not realize are there. And maybe once they do, they can be encouraged to be more physically active just to take the benefit of doing something that very few people can take advantage of.
It's absolutely true. I mean, not everyone has that ability. The safety aspects are really great as well. The other good news is that a lot of people in Arlington and DC do take advantage, as you've already said. So the other reason you all are high up there is not just because the environment is good, because you can build it and they don't come, right? These areas have built it and the residents are at a higher level of health than other areas. So you all are taking advantage of that, which is great.
So I can run down Constitution Avenue in the evening after work, and I can run into the Uniform Division of the Secret Service, the U.S. Park Police, the DC Police. It's the safest place in the country to walk or run or stroll, or as we here in the well-being community have decided, we can saunter at our leisure.
Exactly.
Anything else you want to say on that point before we start wrapping things up here?
Well, first, what I'd like to say is I love the fact when you and I talked previously that the Bar Association has done this and has put these pillars in place for the health and well-being of those in the bar. And I'm grateful for that. And I'm grateful that the physical, nutrition, and exercise are part of that because as you know, as my profession, I can't help but profess this all the time. And then finally, just again, get people moving. And just a little touch upon nutrition is 80% of the time, just try to make great choices, but also don't fret over things, but try to do your best making those nutrition choices too. But getting moving every day is something is always better than nothing.
And I think that's a perfect ending point to the podcast. Dr. Volpe, thank you very much for your time.
Thank you.
Thanks to our listeners for taking time to listen to this. If today's conversation resonated with you, we'd love to have you join us. The DC Bar Wellbeing community is open to those who want to be part of building a healthier legal profession. Visit the DC Bar website to learn more and become a member. And there's always something happening, from live programs to on-demand resources. DC Bar Communities offers a wide range of well-being activities to meet you where you are. Head to the DC Bar website for a full list of upcoming and on-demand programs. If you enjoyed this episode, please like and subscribe to Brief Encounters. And be sure to check out Toward Wellbeing, the DC Bar's Lawyer Assistance Program podcast channel, for even more conversations dedicated to your well-being. Join us tomorrow as we discuss the next pillar of lawyer well-being, the intellectual pillar. Take care of yourself. We'll see you next time, and thanks for joining.